Hi, I'm Dr. Nozer Sheriar. I'm a gynecologist, a husband, a father, a son, and a brother, and I'm professionally privileged to be caring for women. I love reproductive rights, and I have this sticker always on my laptop, which I flaunt at every occasion. I was going through the security a few years ago at Delhi airport, and the CISF Jawan asked me, Sir ji, ye reproductive rights kya hote hain? That was my entry point to my elevator speech, and I told him about sensitivity, I told him about choice, I told him about respect and autonomy. And this man said in his Haryanavi accent, Sir ji, ye to bahut achhi baat hui. Reproductive rights, according to me, are human rights. And yet it is ironic that while human rights are universally accepted, reproductive rights are not. Human rights are the freedom and the advantage that everyone should be allowed to have, and these are generally protected in constitutions, in law, and held up by international conventions and treaties. Reproductive rights are the rights related to reproductive health. Now, these rights are not given the same place and respect that human rights are, and they vary from country to system, and they tend to very often conflate with what people's rights should be. When I talk about reproductive rights, you have to understand that reproductive rights are very often derived from human rights, and the Center for Reproductive Research has identified 12 such human rights from which reproductive rights are derived. I have picked for today's talk 6 of these because I believe that these are particularly important. They are the right to life, they are the right to health care, particularly sexual and reproductive health care. They are the right to information and the freedom to make a choice and decide whether or not to have children. They are the right to privacy, the right to be able to be free from practices which are harmful and dangerous. And finally, the right to enjoy the benefits and the fruits of scientific progress. When you look at reproductive rights in a utopian world, they should be available to everyone. But in the real world, they are not. In the real world, discrimination happens on basis of age, gender, caste, religion, ethnic background, sexual orientation, and of course, social backgrounds. Today, I talk to you about reproductive wrongs based upon these rights which people have normally been assigned. Let us talk about the life course of a woman starting from youth, maybe even childhood, going up all the way to the midlife, maybe starting from the age of 6 to the age of 60. John Donne has said, "Send not to ask for whom the bell tolls, it tolls for thee." More than 200 million girls and women alive today have undergone female genital mutilation. You can call it by any name, and they are in 30 countries in Africa, the Middle East, in Asia, and yes, even in India. Now, when I prepared the scientific program for the FIGO World Congress that we held in Rio, where I was the scientific chair, we had a session which we called Hello Doctor, and we had this amazing young Zulu woman who stood up on stage and told us about FGM. She ran away from home 3 times until her grandfather, who was the village elder, said she will not be touched. But other girls weren't so lucky. Girls as young as 6 and 8, trusting girls, are taken by mothers and aunts to have a brutal procedure which has absolutely no medical benefit and only harm. It is, according to me, a reproductive wrong to violate the basic right to physical safety, integrity for children, girls, and women. The next reproductive wrong I'd like to speak on comes from the fact that globally, fewer than 1 in 3 children say they had adequate sex education as they were growing up. A scientific study in India told us that 71% of youth from 17 of our states said that they were neither taught about sexuality either at home by their parents or in their schools by their teachers. Comprehensive sexuality education, family life education, or whatever you want to call it, is basically a curriculum-based structured teaching which tells children growing up and young people about social, psychological, and physical aspects of their reproductive health. It basically equips this child or this young person with the tools, with knowledge, skills, attitudes, and ability to get forth in life. While sex education exists and we know it helps, somehow application lags behind. I believe it is a reproductive wrong when a life skill which can make a young person a better adult and safer for themselves is denied to them on a cultural justification. Coming to the next wrong, in 2019, there was an article in the Times of India where I was quoted, which told us that medical terminations of pregnancy in Mumbai in young girls had dropped dramatically. And this was surprising. Initially, the numbers seemed quite positive, but actually, there's a story behind those numbers. In 2012, our parliament passed the POXO Act. Now, the POXO Act is an important act to protect children from sexual abuse. But unfortunately, they also lowered the age of consent from 16 to 18 and in effect criminalized all sexual activity under the age of 18. As a consequence, knowledge of a young person having sex has to be reported to the police, whether you're a doctor, a teacher, or a lay person. And that's where the problem arises. Because young people may also have consensual sex. And this is then in the system and creates a lot of problem for them and their families. But most importantly, when they avoid health care, it puts them at the gravest risk because they will go to untrained providers. So I believe it is a reproductive wrong for young people not to have the right of choice, not to have the autonomy, and not to be allowed the capacity to consent. It has been taken away from them. About 287,000 women died during and following pregnancy in the year 2020. This amounted to 800 deaths every day and 1 death every 2 minutes. Since you started the program this morning, that would probably be somewhere between 200 and 250 women dying during pregnancy or immediately thereafter. Now, what bothers me is that most of these deaths could have been prevented. We celebrate motherhood. We believe we put it on a pedestal, but when it comes to stepping forward and caring for these women, we as a society have not lived up to our responsibility. But it is far more serious for a family who loses a young woman in something that's otherwise a very physiological process. In fact, it is devastating. So I believe it is a reproductive wrong for a woman who risks her life for the benefit of humanity, and she is not given the care that she needs at this particular time. The next reproductive right comes from the fact that many pregnancies are unwanted. India's contraceptive coverage is about 47 to 50%, according to this study we have called the NFHS. 99% of married people, and yes, it's mainly married people, said they knew about contraception, but just 57% of them were using an effective contraceptive. In fact, female sterilization, which is a permanent method, which does not cover young people at all, who need other spacing methods, is the majority of cases at about 40%. So there is a mismatch between knowledge and application, availability and accessibility, and this reliance on permanent methods that has put us in the situation we are. That cost and the judgment and stigma and difficulties that is placed for the access to contraception by young people creates a further problem. Half of the 48.1 million pregnancies in India are said to be unwanted. Of these, a significant percentage, more than 75% of pregnancies, were terminated. And this was a study by the Guttmacher Institute in 2015, and this scientific study brought certain facts to the fore. The first thing they told you was that when people do not have a wanted pregnancy, they will do whatever it takes to not continue the pregnancy. It also tells me that if you don't allow the woman this difficult choice that she makes with dignity, she is going to find ways to do it anyway. And remember what I told you about maternal mortality before? The third leading cause of maternal death, even in our country, is an unsafe abortion. Something we can get rid of just tomorrow if we decided to give women the choice that they ask for. The Guttmacher Institute also tells us that you may try and restrict abortions, but the prevalence of abortions, whether it's legal or illegal, is exactly the same. So I believe when you restrict abortions, it is only the safe abortions that you're restricting, not the unsafe abortions. Cancer, cervical cancer, caused 342,000 deaths in 2020, and 1/4 of these came from India. Now, this is truly tragic because cervical cancer is truly a preventable cancer. It is preventable because it can be picked up by technology which has existed since 1940, a very simple pap smear which can pick it up when it's precancerous and stop it from moving ahead. But today, we also have a vaccine because we realize that all cervical cancer is caused by the human papillomavirus, and the HPV vaccine has the potential of even stopping it from getting to the precancerous state. Why then in my practice did I see so many patients with cervical cancer in the last 3 months? A failure of the system to reach out to women, a failure of women to reach out for help, and finally the difficulties in using vaccines that the world increasingly faces, particularly when parents are told that HPV is a sexually transmitted infection and none of them wants to think about this when it comes to their own children, girl or boy. I believe it's a reproductive wrong for a disease which is completely preventable to take the lives of so many women, a disease which can be prevented or treated completely even before it reaches the stage of cancer. And my last wrong is something that might not firstly connect with a young audience. But remember, there are people in your life that you love, you're very close to, who probably are going through this phase. It is said that women aged 50 years and over accounted for 26% of women and girls, up dramatically by 5% from 10 years ago. I wrote this book that you were told about with a friend of mine, Shonali Sabarwal. It's called Finding Your Balance, Your 360-Degree Guide to Perimenopause and Beyond. And it opened my eyes because we started talking to women. We got feedback from women and we realized that here is this inevitable condition that half the world's population is going to go through. It's called the midlife because truly it's the middle of that woman's life. She's still going to spend maybe 40% or even more after that. There are physical changes and hormonal changes, but more than that, there is embarrassment, there is doubts about self-worth, and trust me, the people around her aren't always sensitive and helpful. In many cases, treatment is available and it's denied, sometimes refused by the woman who has misconceptions about the treatment, and sometimes refused by the medical system who thinks it's a physiological process, you got to go through it, don't worry, you come out at the other side. Families, friends, and colleagues that she has cared for and that she has carried through her life don't always understand and reciprocate what she is going through. So I believe that it's a reproductive wrong, that something which is so natural, that something which is so inevitable as the midlife is not given the recognition, the sensitivity, the respect, and the care that it deserves. My list of 7 reproductive wrongs is incomplete. I mean, we have to acknowledge the wrongs done with gender-based violence. We have to acknowledge the wrongs done to the entire spectrum of LGBTQ and the varied sexual orientation and neglect of women and couples grappling with infertility. But I believe we can right these wrongs. Each one of us can commit in our own way. Anasuya Sen Gupta said, too many women in too many countries, speak the same language of silence. Find your voice. Speak up. Speak for yourself. Speak for others. Speak on issues. My friend Ajay Rane, who's a urogynecologist from Australia, was asked by the health minister of a Southeast Asian country, how can we do this kind of genital cutting safely? He said, very easy, don't do it. Just because some other helpless person not in your life and does not directly impact your life is going through it does not mean that you do not have a responsibility to take a stand. Kofi Annan said, knowledge is power, information is liberating, and education is the premise of progress in every society and family. And the WHO has said that there is enough proof to show that comprehensive sexuality education works and that it protects and it prevents unwanted pregnancies. Mohammed Fatala has said women are not dying because of diseases we cannot treat. They are dying because societies have yet to make the choice that their lives are worth saving, decision that their lives are worth saving. Bleeding after delivery is the most frequent cause. We can take steps to prevent that. We just need better facilities, we need more blood, we need transport. But I told you about unsafe abortions, and that can be done away with by the stroke of a pen. Margaret Sanger has said, no woman can be called free unless she owns and controls her body. She said that she can only call herself free when she can choose consciously whether or not to have children. And I think contraception and abortions are about reproductive self-determination, and you have to take responsibility for your choices and for your safety. Finally, when it comes to dying of cervical cancer, we could wipe that off immediately, and the WHO has a plan. 90% fully vaccinated by HPV. Those of you all who are here not vaccinated, please go and get the vaccine. 70% to be screened by a pap smear by the age of 35 and then 45. Make sure your mothers and aunts get their pap smear. And finally, when there's disease, 90% should be treated. I'd like to end by a person we all admire greatly. Mahatma Gandhi said, the future depends on what you do today. Speak out. Speak up. Shout from the rooftops when an issue kind of holds your attention. Stand up. Stand up to bullying, shaming, stigma, and condemnation. Stand up for yourself. Stand up for others. Volunteer. Get involved. Stay optimistic. And please believe in your capacity to make the world a better place. Thank you.